pressure on a vessel inside, and frequently that is all you need to prevent scalp bleeding, rather than trying to find the small vessel and tie it off. A slip knot is a very effective suture, especially with young children. The sutures can be removed without having to come at the child with instruments, especially a blade or an iris scissors and a forceps. You're able to remove it simply by removing the proxy strip or steri strip, grasping the end of the suture and pulling it. And it's inserted identically to a simple skin suture. The only difference is that after the 2 turns, instead of grabbing the end of the suture material, you grab it in the middle, resulting in a small loop like this. Each time you tie it, you grab the loop instead of the end. After 4 ties, you then cut the end connected to the needle and cut that quite short so you'll know the difference. To prevent the child from removing this, one piece of steri strip or proxy strip is very effective. When it's time to remove it, you simply grasp the long end with your fingers and it comes out. Although the tension or the tensile strength prior to removal is the same as a regular simple suture. Subcuticular sutures are excellent for obtaining very good cosmesis, especially on face lacerations. If this is the laceration, one would enter proximal to the wound, exiting inside the wound, just under the dermis. One then weaves back and forth underneath the surface, just a millimeter below the skin surface, back and forth until you reach the opposite end. And it's okay if you backtrack a little bit so that you actually enter proximal to the exit on the opposite side. And again, this is all just underneath the surface. Small little bites, making sure that you don't go through the loop with the suture material. This is somewhat more time-consuming than simple sutures, but the nice aspect is there is no cross-hatching possibility whatsoever, because there are no sutures crossing the wound. Now, as you exit, you do the same as when you started. You come out now distal to the wound. Resulting in a very fine scar that you can actually pull the suture material through. And then to tie it, each side is treated as if you are tying a slip knot. The proximal side is tied off with a small knot, each time grabbing the loop, and usually 4 knots are all that are needed. And the same procedure on the opposite side. And you can even stretch it out until you have just the right amount of tension on both sides. And this loop can be made a bit larger if you wish, but it isn't necessary. And that is a subcuticular stitch.